Thank you, and I know everybody's having a great time, but Dr. Rick Snyder is here. I see the kids with no long sleeve shirts on, and it worries me so much. Let me introduce. This is Dr. Rick Snyder. He's from the Dallas County Medical Society. We appreciate you being here tonight.
Glad to be here, Heather.
Listen, you signed the letter. You want aerial spraying done right now in Dallas County. Things are that bad, it's got to be done from above, you think?
Well, let me walk you through the genesis of this letter and this recommendation.
Okay.
We have a very involved, a very concerned infectious disease community of experts who collectively have centuries worth of experience and judgment dealing with infectious diseases going back decades. They got together about 10 days ago specifically because of their concern of what they were seeing in the community with West Nile virus. It was about 10 days ago on a Friday, and that's when the word aerial spraying first started to come up, but they weren't really ready to make that commitment yet. A week later, our fatality rate and case rate almost doubled in just that span of time. And if you look at the trajectory of the fatalities and the case rates, we are witnessing historic levels of West Nile virus, not only for Dallas County, but also for any urban area in the United States.
Okay, but even with that trajectory, not everybody agrees with you. In fact, we talked earlier today to Zach Thompson, the director of Dallas County Health and Human Services. Let's take a listen to what Zach had to say.
And until somebody can give me that answer, who actually can tell me in an urban setting where you've done this and there's not been any fallout, there's not been any issues with health repercussions from citizens complaining or lawsuits, then I'm open for that. I'm open for that discussion.
Okay, so he says he'll have the dialogue, he'll have the discussion, but he wants to make sure that this is safe. That spraying from above is safe. Is it going to be safe?
Well, let me tell you, this is a tough decision, but the good news for your listeners and the Dallas residents is that aerial spraying is not only effective, but it is safe. Now, we do not have a lot of precedent. I'll agree with you that.
Okay.
But the precedent that we have, the examples where aerial spraying has been applied in urban areas, it's shown it has been effective and it has been safe. In case in point, in 1966 in Dallas during the St. Louis encephalitis epidemic, aerial spraying was part of the treatment protocol to deal with the mosquito outbreak that we had. In 2005 in Sacramento, there was a large urban area outbreak in Sacramento where aerial spraying was not only found to be effective, and in fact a paper in 2009, an infectious disease article, one of the documents that we were provided in helping making this recommendation, showed from the time point that aerial spraying was applied, there are no more new cases, and compared to the untreated areas, you were 6 times more likely to contract the disease and become ill from the disease.
Okay, so two thoughts on that. Number one, I hear 1966, and I think, okay, that was so long ago. Certainly, we've had a lot more advances since then. But then I think of the Sacramento situation that you're talking about, and if you say there are no more cases, and they were on it sounds like even deadlier trajectory than we are now, then what is aerial spraying doing? It's coming in and wiping out everything, and I think, okay, that's too much.
They're actually killing mosquitoes, and what Sacramento is actually doing this summer, they're actually applying aerial spraying and not waiting for human cases of West Nile virus. They're actually using surveillance methods, looking at the population of mosquitoes and the infection rate to help trigger a decision for aerialized spraying. So it's a preventive measure.
Well, so let me ask you, have we waited too long? Because we've got, you know, about fewer than a dozen deaths now, but what, about 200 cases of people who are sick. Are we waiting too long to do something?
Time is clearly of the essence. For aerial spraying to be effective, it has to be done early, not later. Okay. We are a little bit more than halfway through the West Nile season, and really for it to be effective, it really has to be applied probably within the next 2 weeks, probably, you know, sooner rather than later.
So who's paying for it? I'm imagining it's going to cost a lot of money.
Well, I imagine the city's going to pay for that, but it was made aware to me that the city does contract on a yearly basis to make available aerialized spraying if the situation has arisen. The question is, has the situation arisen? The CDC, again, actually classifies West Nile outbreaks according to levels 1 through 5, 5 being the highest. We are clearly at that level 5 level of outbreak. And if you look at the recommendations that should be considered, aerial spraying is clearly a recommendation from the CDC guideline dealing with West Nile virus.
So let me ask you, what do you want to say to the parents when you look in Calvert Collins live shot? You've got girls in swimsuits and kids without shirts on. smart idea, or cover them up?
It's probably not a smart idea. The wisest idea is to clearly keep with the basics. Conventional treatment protocols would tell you try to avoid being bitten by the bug.
Right.
Cover up. Try to wear insect repellent. Avoid areas of standing water. If you have standing water in your yard, try to eliminate that, drain that. Dog water pails have been a concern. Try to avoid areas such as dawn to dusk, where they're the highest times that mosquitoes may be out and biting people. And then, try to be smart. Make sure your screens are up. These are the conventional things. These are the things everyone should be doing every day. The number of cases, however, lead us to believe that we need to do more. Now, clearly, the city and health department is doing a good job with the ground spraying, and for I understand, they are going to be escalating the ground spraying, so they are making changes and adjusting to the environment. I understand that they will be increasing the ground spraying to 3 nights in a row, which is supposed to be the most effective way. Right. The concern is that may not be enough, but we don't have a crystal ball. We are relying on a recommendation from 13 infectious disease experts throughout the county who represent a broad base of every system that we have, who collectively have the greatest concentration of experience and judgment that we can rely upon in Dallas County. That recommendation then went to our Community Emergency Response Committee, which met on Sunday night from 7 o'clock. It was a unanimous vote, a 13-0, so we had a unanimous vote from this informal infectious disease committee, a unanimous vote from our emergency response committee, which then went up to our board of directors, who also looked at the data, looked at the recommendation, and unanimously recommended that aerialized spraying should be considered by the health department and the county commissioner's court.
All right, well, we'll keep following it. Rick, thank you very much. I appreciate your time. And listen, we want to know what you think. What is your